I think people are just confused. Is it COVID? Is it viral gastroenteritis? Is it influenza A?
RSV.
Is it influenza B? Is it strep?
Yeah.
Is it pneumonia? Is it like, what is it?
Honestly, I think a really hot topic is influenza.
The flu.
You know, type A, type B. I'm seeing it a lot in the office.
I think people are just confused. Is it COVID? Is it viral gastroenteritis? Is it influenza A?
RSV.
Is it influenza B? Is it strep?
Yeah.
Is it pneumonia? Is it like, what is it?
Well, the problem is that first of all, I'm seeing a lot more RSV.
Yeah.
Like tons of
That's
RSV,
why
especially in the hospitals.
That's why the vaccine came
Well, it's
along.
okay. No, listen. I think that's something we should talk about. Listen, it doesn't matter. You get your opinion. I get my opinion.
I'm gonna stay away from the vaccine.
I just think that if you
talk
get
about
the
it.
flu vaccine, your risk is lower. Simple as that. And that's what I've seen. I'm not saying go get it if it's your choice.
My theory is like this: if you've been getting the flu vaccine your whole life, get it.
Yeah,
because the second you don't get it, you're gonna get sick.
Yeah, exactly.
But if you've never gotten a vaccine and you're a healthy 20-year-old, it's up to you.
Yeah, and it's not like if you get the flu vaccine, you're not going to get the flu. Well, let's get that straight. You could still get a chance of getting the flu.
And most of them do.
Yeah, and a lot of them still get sick.
I'm not saying don't get the vaccine.
People get
I'm
sick
just saying,
from the flu vaccine.
Yeah.
So, listen, I'm a doctor. I give it in my office. I have
that's
patients
pretty bad
that
if
want
the
it.
doctor doesn't know what to give you like that. There's no direct answer to it. That's
There is
bad.
no direct answer because, okay, as a doctor, I'm going to recommend it to take it.
Yeah.
But it's your choice. It's nothing forced because I've been taught to give the flu vaccine to reduce the flu.
Yeah.
And there's a huge incidence. 8% of Americans get the flu every single year. That's a big ass number. You see what I'm saying?
I get it. Listen, I also think it depends on the age factor. You know, if you're an 80-year-old with your autoimmune disease, you have cancer, you have all this chances of getting the flu really, really high. I think you are, a better candidate to take it than, for example, a 17, 18-year-old kid that's extremely healthy, that exercises, that eats well, never gotten the flu before.
You're right. I'm not going to argue that. But then it comes down to choice also then.
I know.
It's a choice.
Look, my biggest thing is that I've had a lot of people get the influenza vaccine and the RSV vaccine and get really, really sick. I mean, hospitalized sick. I know it's rare cases. It's 1 in a million. I get it. Everybody should get vaccinated. Look,
are you saying everybody should get vaccinated?
No, you're saying that.
I never said that. Let's get that straight.
For me
I recommend it as what I've been
For me personally,
trained.
the vaccines have not worked for me very well.
Okay. They have worked for me because I don't get sick.
I've gotten very sick from the vaccine. So me personally, it wouldn't work for me.
Well,
because I get it and I get sick.
Did you get the COVID vaccine?
Huh?
You had COVID, didn't you?
Listen. AJ,
I got the COVID
AJ,
vaccine. I'm telling you, I got the COVID vaccine, and I never got COVID.
In 2023, I feel like I can get canceled by looking at you.
Yeah,
so I'm trying to avoid saying anything because I swear to God,
we're not recommending the vaccine, MJ. I'm not saying I'm recommending the shot.
How about
I'm not saying anything.
Get away from the vaccine?
Okay,
let's go into flu symptoms and everything else.
I know. I'm just saying I had the COVID shots. I never really got COVID, but I had patients who didn't get the COVID vaccine, who got COVID, or who didn't get COVID. Same thing.
You're also abnormal. Look at you, bro. There's nothing normal about you. So listen, we're not going to go into the topic of normal and abnormal.
You're not willing to go into the topic into vaccines, but you're calling me abnormal.
I'm not calling you abnormal, meaning like you look abnormal, even though if that's the case, it might be the case. I'm talking about you're abnormal because you don't get sick, not because you look abnormal. Fine. We've already discussed that last
let's
episode.
Talk about the flu. Let's talk about the flu, okay? First of all, what are types of symptoms that you get with the flu? And I think you and I both know, but you can say a few and I'll say a few. Go ahead. I'll give you the mic.
Body aches.
Okay.
Your turn.
Fever.
Cough.
Headaches.
Diarrhea if it's viral gastroenteritis.
Does your body aches also mean muscle pain?
Like myalgias?
Yeah.
Yeah.
Okay.
Joint pain?
Okay.
Joint pain.
Sore throat.
Runny nose.
Damn it. I was going to say that one. Fever. Did I say fever? I did say fever, didn't I?
You said fever earlier.
Okay. So I think we kind of named the majority of them, right?
Boners.
You get boners?
I do.
No, that's Thomas.
Thomas lost all that weight, poor guy. We always pick on him. By the way, for people that don't know Thomas is our ride or die. He's been with us since day one. He gets everything done for us. He recently did the $75
$75?
Guys, I'm not feeling good.
75 days.
Sorry, let me
75 days.
restart. For the people that don't know Thomas is our ride or die. He's been with us since day one. He helps us get the podcast up and running, and he does everything for us.
Thomas is
he is
DocTok.
DocTok,
Yeah,
and
Thomas is DocTok.
he's recently lost a lot of weight.
Yeah.
And he's feeling good. He's walking
He is.
around very cocky.
Yeah, I kind of hate how
He
cocky
feels
he's become,
good. His
honestly.
shirts are tight. He went from
Yeah.
like a 3X to a medium, and it's just I'm not used to it, you know.
Medium.
But you guys will get to meet him and understand who he is. Sorry, let's get back to the topic. Let's start over. I seen his nipples popping out, bro. I'm like, bro,
that
just because you
medium
lost weight
shirt.
doesn't mean that you have to wear the tightest shirt of all
He's wearing
time.
the tightest
bro,
white
the
shirt. I don't
tightest shirt
get it.
ever, and his
Why?
pants. Why is his pants so small? Like, dude, we understand you lost the weight, bro. But chill out. Sorry. Okay, get back to flu, guys. Sorry, we get into a whole different thing. So we said the symptoms for flu.
Yeah.
Okay. The problem that people are understanding, like, can't you get all those symptoms with COVID also?
You can. I mean, it's viruses in general, Mo. But the problem here is that everybody wants a quick fix.
Yeah.
And that's the issue. And viruses typically stay in your body a lot longer than bacteria does.
I think
you
the
know what I'm
first
saying?
most important thing is figuring out, is it viral, bacterial, or fungal?
For
Like,
sure, but 95% of them are viral. That's the issue. So the majority
Yeah.
of them are viral. But yeah, a lot of doctors still treat
what
with
about fever?
antibiotics.
Low fever, high fever?
I think it just varies. You've had patients with high-grade fevers, and you have patients with low-grade
Mostly
fevers.
bacterial grade fevers,
Yeah.
and then
the
low
secret is the
grade.
scary part is the lungs. If it starts affecting the lungs, right? You
Yeah.
can have the nasal congestion, you can have the sore throat and body aches and fever, but as long as your lungs and your breathing is not affected, when your breathing is affected, that's something when you definitely have to look into it because that's the scary part.
Yeah.
The pneumonia, the viral pneumonia. is pretty bad.
Viral pneumonias are horrendous.
Oh, they're a disaster.
So
They're a
I'll be honest
disaster.
with you, that's the one thing where I feel like the flu vaccine and like the COVID vaccines come in handy. The
Are you
people-
recommending it?
We're
Oh,
not getting
sorry.
into that.
Oh,
I'm just
sorry,
saying,
sorry. Okay.
patients that do end up with viral pneumonia, the survival rate is higher for people that have been vaccinated
I agree.
versus not. But again, if a 17-year-old athlete is being pushed to get the vaccine, I don't
Yeah.
know if it's really necessary.
Yeah, you're right.
No,
You're right.
like for all the vaccine companies watching, don't cancel me. I'm sorry.
What
but-
about patients who get the flu every year? Not the vaccine, just the flu. Every year they get the flu for some reason.
Yeah.
And they're wondering if they should get the vaccine.
How old?
32.
Healthy?
Pretty healthy. I would say not extremely healthy, but not
Like
also...
Tom is healthy?
Tom is healthy.
Like in the middle. Got you.
kind of like right in the center. There.
Why do we keep talking about vaccine?
We're not talking about vaccine. I'm just asking what you would do.
I-
So you're a doctor.
I understand.
I came into your office and I
Yes.
get the flu every single year. I
Have you
don't
had
want
the-
I don't want
okay.
the vaccine. But would you
Have you had
recommend
the vaccine before
it? I've never had the vaccine before.
in your life?
Never had the vaccine before. And I've had pneumonia twice out of the 10
Bacterial
years.
pneumonia or viral pneumonia?
I don't know. I went into the hospital and they gave me a bunch of stuff. I don't know what they gave me.
Did they give you antibiotics?
I don't remember. I just went into the
So
hospital.
you have dementia. So you're a 32-year-old with dementia. Just so I
they
understand.
listen, they gave me a bunch of stuff through an IV, and I don't know if they gave me antibiotics.
You're 32 years old. You can't remember nothing they did in the
Bro,
hospital.
we're not all doctors. They don't know. They just gave him some medication. They know they gave him meds. I don't know.
Yeah, first thing I would tell you
they
is...
gave me. Okay, don't be a smartass.
I'm
They
just
gave me-
saying
okay,
you're...
they gave me
okay, sorry,
antibiotics.
start over.
They gave
so
me
a
antibiotics.
32-year-old male with dementia presents to the clinic.
I never said I had dementia. Okay. No. Yes, they gave me antibiotics.
Okay. They gave you antibiotics.
Yeah.
Okay, so it was a bacterial pneumonia.
No, you could still give antibiotics to patients in the hospital, and you don't know if it's viral or bacterial.
Okay. So you're asking, should I give him the flu vaccine?
No, I'm asking, would you recommend the flu vaccine?
I would say it's up to him.
Okay.
Would you
Okay.
like the flu vaccine?
Can you educate me on the flu vaccine? Like, be like, okay, doctor, do you think I should get it?
I will let you know that, yes, it will cut down on the chances, but also when you get it, you can get sick because the antibodies in your system. Also, how close. This is another thing people need to understand. If you get like the COVID vaccine and then you get the flu vaccine right back to back, the antibodies, both of them at the same time, can make you really sick.
Yeah, I agree.
And I think if you've had COVID and 2 weeks, 3 weeks later, you're feeling better and then you go get the vaccine, I think that's not smart either because you
Yeah.
have antibodies. I think if you have like any type of virus, the flu vaccine, flu, influenza, whatever it is, and then you want to go get the flu vaccine, I don't think it's the smartest idea. I think you need to let your body recover. Look, AJ, I'm going to be completely honest. I have been getting into more natural methods, right? I'm trying to avoid going in and giving too much medications, giving too many vaccines. I'm trying to go down the route of eat better, exercise, sleep.
agree.
Now, if you are somebody that doesn't eat right, that doesn't sleep right, that your immune system is crap, go get it.
Yeah, and don't expect your body to take care of you if you're not taking care of your body.
Like, go get it.
Simple as
If you're giving up on life and you don't want to do anything else, and I can't help you, and you think that the only option is to get a vaccine to prevent it, then do it.
Yeah, and stay away from sick people. For the love of God. Like, I mean, if somebody's sick, stay away from them because it's contagious.
Like, unnecessary, especially if there's somebody sick in your house.
Yeah.
Separate, bro.
Exactly.
Like,
exactly.
I think COVID, it's coming around a lot stronger this year for some reason. I'm seeing a lot more.
Yeah, me too.
I'm seeing a lot more influenza. RSV
I've
somehow.
seen tons of it. And I'm prescribing a lot of the RSV because a lot of patients have been asking for it.
Well, the vaccine?
The RSV vaccine, yeah.
So let me ask you a question. So for the last 5 years, I barely saw RSV. And last year, the vaccine came out, and now we're seeing RSV.
Well, I've been trained that a lot of it is more in the younger patients. But actually, these days, it's actually kind of both, young and adults. You're getting in.
But the RSV vaccine has been out forever.
It's just
why have they been pushing it recently?
RSV's new.
RSV, I understand, but they've had something for RSV or no?
No.
First time.
Just came out.
So just so I understand, I set you up. You know I set you up for that.
Yeah.
I literally set you up for all of this.
Okay.
So RSV has been around for a long time.
Yeah.
All of a sudden, you're seeing a lot more RSVs
in adults
right as the vaccine came out.
What are you trying to say?
I'm trying to say...
Be careful here because they're going to go after you. RSV's going to talk shit right now. I'm just saying.
I'm for the people, bro. I don't care about the vaccine. I'm for the Thomases of the world, bro.
Okay, I get it. I'm not
With
for
nipples
the
out
vaccine.
and everything.
I get it. But if we're seeing a virus that is more prominent, we create a vaccine to try to reduce it.
Yeah.
Right or wrong?
I get it. I like natural.
Yeah.
I don't like meds. I don't like vaccines.
I'm not going to get RSV.
But you're recommending it.
For my patients.
Wow, guys.
Yeah, for my 65-year-old who has cancer.
Yeah. We just had this topic. Yes, I agree. For somebody 65, yes, with cancer.
Okay, so you're recommending it.
Not a 32-year-old.
But we're not talking about, I don't have patients that are 32-year-old. Do you have 32-year-old patients? I have maybe one.
Yeah, one.
Yeah, okay, that's fine. You probably don't have to recommend it for the 30. I don't even think it qualifies for that. I think RSV, there's a certain age. I think it's over the age of 50. I'll look into it. We'll look into it. But still.
Okay.
So RSV is the RSV vaccine including, it's for adults 60 years and older. Using shared clinical decision-making. Shared clinical decision-making recommendations are individually based and informed by a decision process between the healthcare provider and the patient. So it's for 60 years and older. So that's fine. So it's typically patients with multiple chronic complications. So let's rephrase here. RSV is very typical, is typically prescribed for 60 years and older. So yes, the majority of my patients are 65 and older. So that's
I think also we deal with geriatrics, so we're specialists in geriatrics.
Yeah.
So we're better with older folks than younger folks. I do believe that if you can try to change your lifestyle before we start going down the path of medication and vaccine, it's better. But if you're already at that point, you're 70 years old, you have cancer, yes, get the vaccine.
Yeah.
You know.
Okay.
But what do? I'll give you an example. I am a 40-year-old male. I have diarrhea, vomiting, body aches, and fever.
Okay.
What do I do?
I would hydrate. Stay at home. Tylenol.
What do you think it is, first of all?
Viral gastroenteritis, most likely.
Okay.
Okay.
Do I go to the hospital?
Well, it depends. It depends if your fever is controlled and if your pain is controlled. It depends on your symptoms. If it's tolerable, I would go on a liquid diet, most likely at home. I would take Tylenol around the clock to control your fever, and I would get rest, fluids, rest, Tylenol, or ibuprofen for fever control.
Is that you or me?
That's me. So that's what I would do.
Okay.
What would you do?
No, I agree. The biggest thing with viral gastroenteritis is your intestines are inflamed. They're infected with the virus. So you're going to get abdominal pain. You're going to get diarrhea. I've had it before. It's terrible. It's horrible. It's not a good feeling. So definitely Tylenol all around the clock. Ibuprofen specifically if you have like ulcers, you have risk factors of bleeding. Don't take that. Take Tylenol. You could take up to 3 grams of Tylenol, even if you had liver problems.
Yeah, you can exactly.
But also making sure that you watch what you eat because your intestines are inflamed and it has a virus in it. So you eat a steak or you eat something fattening, your stomach pain is going to get worse. Like AJ said, rest, sleep, all of that is very, very important. And staying on a clear liquid diet, replacing your electrolytes specifically. Because what ends up happening, AJ, is when you get the diarrhea, you're getting rid of a lot of your potassium, so you get muscle cramps. So, drink Pedialyte so you get sufficient amount of electrolytes, liquid IV, whatever it is, replacing your potassium, magnesium.
You could advance your diet after that, depending on your symptoms. If your symptoms improve and you feel that you can tolerate more food, then go ahead and advance your diet to like a softer diet, mashed potatoes, Jello, etc., yogurt, and then you can just advance it from there. But flu It's popular.
We talked about flu. We talked about COVID. We talked about viral gastroenteritis. And then obviously pneumonias, and that's a whole different topic.
Yeah, but stay away from sick people. That's the secret. Stay healthy, exercise, eat well, and sleep. Sleep is huge. Reduce your stress, and go from there. And if there's
don't wait till you get sick to try to change your lifestyle.
Yeah, man. It's just you gotta start it now, not tomorrow, not on Monday.
I don't want to jinx it though, AJ. I will tell you, like since I've changed my diet and I've changed my sleep cycle and I've started exercising and I gained a little bit of weight in a healthy way, I have gotten sick less.
Yeah, I see
which
that.
95% after this episode, I'm going to get sick because the way Thomas is looking at me.
Yeah, for
so
sure.
yes, but I have changed my lifestyle. I have eaten healthier, and I do believe that has helped keep the viruses away. You guys got to understand, your body is going to war against this virus. Yeah. Your body needs a military.
Yep.
In order for your body to get a military, you have to build that military. Eat right, sleep well, exercise, do all these things. These things that you do is your military against this virus, an aggressive military. So
exactly.
That's how you have to look at it. And if your body is not ready and you don't have those armies and you get this virus out of nowhere that sneaks up and starts killing, your immune system, you're not ready for it, you're gonna get sick for longer. It's gonna hurt more, and it's gonna affect you long term, right?
Exactly. So and remember, guys, your body's your sanctuary, right? And I always say is don't expect your body to take care of you if you don't take care of your body. So eat well, sleep, rest. If you guys have any questions, let us know. I know this was a crazy topic, and we had a lot of fun. But we're excited, so
we're not scared to talk about anything, guys. We're not. It's not that we're worried about cancellations or any of that. But again, there's so many things that some people like vaccines, some people don't. Some people like antibiotics, some people don't. There's naturopath. There's people that like medications. We're never going to be able to please everybody. We just give you guys our opinion. The whole point of this podcast is for me and AJ to give you guys what we feel. You guys might agree, you might disagree. And if you don't agree, let us know in the comments. Get involved a little bit more. DM us. Let us know, because if you guys are not letting us know if you feel like it's correct or not, that person that doesn't agree with us in comments says, I don't agree, I appreciate you, because we need that. In order to grow the medical field, we need feedback from the people in the community. So we appreciate you guys.
All right, awesome, man. Well, thank you guys so much. Have a fantastic night. We'll see you guys soon. Thank you.